what are these key HIPAA compliances, and what are the key security considerations for building a healthcare software solution, right? So, going going a little deep into that, maybe Katie, if you could share some insights on the importance of HIPAA compliance and healthcare software solutions, that would really help everybody understand around HIPAA.
Yeah, thank you so much. So my dad will be happy to hear this. He's my co-founder, but one of the things that he taught me just from the very beginning is this kind of run to the danger mentality. And so when building any kind of solution and you have the word healthcare associated with it, you have to be completely prepared to go down the HIPAA compliance background. Otherwise, you won't be able to even get yourself in a room to sell your product or sell your solution. So I think one of the great things about when we were starting to build our solution with Mindbowser is HIPAA compliance was at the forefront of every conversation, because you can't build a solution that has any cracks or any holes. And not only is it important for your own company to go down the HIPAA compliance protocols, but to be able to speak to it and demonstrate it. So for example, HIPAA compliance doesn't require that you audit your policies and your software, but do you audit your policies and software, and what's your internal policies in doing that? So being able to speak to it to your customer will not only help you get in the door, but is just absolutely essential to even begin building a product when you sell it in the healthcare space.
Interesting. Thanks for sharing your views, Katie. My next question is to Peter. What's the role of security and data privacy in healthcare software solutions, and like how critical is it, and what's the overall role about the security and data privacy, Peter?
Yeah. Thank you. I think we've certainly touched on all of the hot buttons, and of course, Katie just talked about the regulatory environment, which I think we've all in our own way pointed out really just increases the spotlight on what we have to do. Obviously, the core tent poles are protecting the information, complying with regulation, and for us, for where we sit in the cardiac rehabilitation, that ensuring patient safety is such a key part of it, right? As we said earlier, that's of course going to be the FDA. If you're going for approval to the FDA, that's going to be their number one top question before you can even move forward. For us, we work with a population that's frequently at risk, and so managing their data and managing the risk factors is really critical part of what we do. It's ensuring patient safety really goes to the next level. If there is the potential for an adverse event, it needs to be recognized and acted upon very quickly, involving a cardiologist in our case in many instances, and alerting them that some action needs to be taken. So that's really all of the key factors that go into building a healthcare app. And I think, as we've all touched on and Vince so clearly mapped out, that's really where the complexity just goes, to the next level, right? This is can't emphasize enough that those integrations with legacy systems, and the S is important because there isn't one, there are a lot, and they're all different. And for us, I would also just mention that we collect a lot of data, heart rate monitors, BP, things like that. Again, this is another level of integration. This is done whether it's done over Bluetooth or Wi-Fi or however you're integrating with them, just continues to add another complexity that needs to be accounted for. Again, I think it's as Katie started this whole thing off with making sure you're not only managing the fact that the data is actually secure, but that it's perceived as secure.
Yep. And speaking about the role of technology, I think, we know it plays an important role. And Peter, you brought that up, that, it's kind of really important that the whole integration happens in a very smooth way. So, on that point, Vince, what do you feel? What's the role of, the overall technology and the new innovations that are happening in this space? How is it shaping the overall future of HIPAA compliance and security in this space?
Yeah, so I'm going to touch on too, on just like the innovation and technology. So I've recently been impressed by a lot of the companies that help you get to like HIPAA compliance and SOC 2. So companies such as like Vanta or Drata, there's a few in the space that they make like the onboarding much like simpler for newer companies. And they've done a good job at lowering the barriers for like helping you comply with HIPAA and SOC 2. So I strongly believe that it's really good for if in your earliest stages of formation, like when you're really just starting the company, that you create like all of the documentation, the policies, the infrastructure, and you don't wait until you become like seed or Series A, like you do it right away. And then a lot of people think that HIPAA is about the technology, the data security, but just good documentation, and the innovation is going into just making that process good too. And because a lot of the big data breaches are not like people and bad actors, like some of them are, but like not most of them are like them accessing your system. It's just lapses in employee policies, and employees retain their access to logins, or you're not periodically generating your new security keys. So just good policies help in that manner. The second is, as we mentioned, is differential privacy, and then how it just really helps with HIPAA. So a lot of people think that you can de-identify a health data set by just like taking out the birth dates, name, social security, which are the obvious information. But you could have data that's identifiable in a clinical note if a patient has like a rare disease, and you can re-identify them. And computers, they've been very good recently at doing that. And so you need this sense of differential privacy to scramble your data so that it is still useful from like a statistical standpoint, but it makes it anonymous so that you can't re-identify those patients. So I'm pretty impressed from an innovative level of where differential privacy is going.